Hello everyone. In this session of first aid, we are learning many important uh, things which you can do with a victim in case of emergencies. We learnt about how to do cuts and dressing, cuts and burns dressing, how to give splint, and now we are going to learn about recovery position. So, you never know where you will be when someone needs first aid. So, this emergency situation, injury, accident can happen anytime, anywhere, at home also. So, in such situation you will need to learn certain things, and one of that is recovery position. So, by giving recovery position, a volunteer or a bystander can help until the first responder arrives. Medical emergencies can happen anywhere at any time, and they can result from progressive condition or a random circumstances. When they happen, the first aid knowledge of the people on the scene can make a difference. So, if you are a volunteer in such situation who has learned first aid, a formal training of first aid, then you are very helpful and it will make difference. Even if you are not skilled in CPR, understanding less intense care techniques like the recovery position can help someone in an unconscious state and stay as stable as possible until the help arrives. So, usually recovery position is required for the unconscious patient, and in this unconscious patient, if you are not trained in CPR, you may not be able to give CPR, but even by giving recovery position, you will be of great help to this victim and till the other help arrives. This is the recovery position. We will describe in detail in next few slides. This is again recovery position. In this previous you will see the victim is made to turn on left side of his body. In this victim is helped to turn on right side of his body, but both are recovery position. So, what is recovery position? Recovery position has been a staple of first aid for decades. It is a specific position of an unconscious or unresponsive person. Let me tell you, the recovery position is most of the time is required for the unconscious person or the person who is not responsive. This has many advantages. First of all, that will keep the airway open, the breathing part of the body, his system will be open and he will be able to breathe properly. Secondly, if there is any foreign material in the mouth like vomitus or something else, then it will drain out when you turn the victim on the recovery position. Thirdly, it will lower the chances of aspiration. Aspiration means any foreign material like saliva, vomitus in the mouth. If patient becomes unconscious, it is likely to enter into the trachea, that is a breathing pipe. So, by giving recovery position, and it is called aspiration. By giving recovery position, you can prevent this aspiration. Everything will drain out instead of going inside the windpipe. Reduce chest pressure. By giving lateral position, there will not be any pressure on the chest, and limit the neck movement. By fixing the patient on left side or right side, his neck is fixed up at rest and it will further limit the neck movement. Originally, the recovery position was on left side only. They used to insist that victim should be turned on the left side only, but people thought this would decrease the chance of vomiting, because people thought that by turning on left side there will be less chance of vomiting. Over the year now it has been realized that either side it is acceptable, whether you turn the victim on left side or right side, it is acceptable. The exception to this rule is pregnant patient. only pregnant patient must be placed on the left side, because their uterus can compress on right side on the inferior vena cava, that is a big blood vessel, and that can obstruct the blood flow to the uterus. So, that is why pregnant patient always should be, if they are injured or unconscious, and if you want to give recovery position, they should be turned on the left side to maintain proper blood flow to the uterus and to the baby. See, this is the recovery position. There are 7 steps you have to learn about giving recovery position. Turn the head of the victim gently to the left and check for breathing and pulse. When you turn the head on the left, check for breathing, whether the victim is breathing or not. Check inside their mouth to see if any visible airway obstruction may be removable. Suppose there is a mouse, there is some foreign particle or vomit, yes, you remove that and clean the mouth. Gently extend their left arm away from their body at a right angle on the floor with their palm up. This left arm is extended away from the body and it is put at the right angle to the body and with the palm facing upward. Place their right arm down on the ground above their shoulder, left shoulder, and this arm will cushion their face when you turn them. So, put the right arm above the left shoulder and keep it below the head of the victim. So, this will cushion the face of the victim. So, turn the patient on left or right. If it is on left side, put the left hand at right angle and palm facing upward. Put the right hand above the left shoulder, below the face, and cushion the face with the right hand. Bend their right knee at a right angle and gently turn their body to the left side. Take care of their head when turning them. So, now bend the right limb, right lower limb or right leg at right angle above the left leg. So, turn it on at right angle and make it comfortable. Place their right knee gently on ground, keeping it at the right angle to their body. People in larger bodies may benefit from a small pillow or roller under their knee for better support. You may put a small pillow or roller under this knee to give the support to the right knee. Raise their chin gently to open the airway. In CPR we learnt extend the face and open the airway by lifting the chin. Here also raise the chin and open the airway. Use their right hand to cushion their face and maintain the position. At the same time, keep the right hand under the face and cushion the face. Monitor breathing until first responder arrives. So, now you check the breathing, patient is breathing properly, there is a airflow from the nostril or mouth, and wait till the responder arrives. Call emergency services as soon as possible, because the patient is unconscious, patient is unresponsive. So, here you will need help of a medical professional. So, call emergency services. The recovery position should not replace professional medical care. It does not mean that you have put the patient on recovery position. So, now he will recover and he will be all right. It is not so. You have to have a help from a medical professional. Even if someone regains responsiveness, they may still need additional care. Still, they should be referred to a doctor or a hospital for further checkup and care. So, these are the 7 steps of recovery position, which is very easy, and you can try to learn on the live volunteer, on your friend, on your family member, and try to give recovery position at home and try to memorize the steps and learn it perfectly. See, this is how recovery position. First of all, this is on left side again, put the left hand at right angle of the body, palm facing upward, then put the right hand on the above the left shoulder and turn the victim on left, put the right leg at right angle and cushion the face with the right hand, palm of the right hand. So, this is the recovery position, which will, the distinct advantage is it will open the airway. So, patient will be able to, victim will be able to breathe properly. Second, it will drain out the secretion or vomiters from the mouth. And thirdly, victim will be comfortable and will be able to breathe on his own. These are again describe recovery position. This is right side. So, here the right hand is turned at a right angle to the body. Then patient is, you alone also can give recovery position in an unresponsive patient, because if you follow the steps properly systematically. So, first of all, hand position of the hand, then turn the body with left hand and left leg, then left hand below the face, secure, giving the support, turn the left leg at right angle and support it with the cushion or something below, and this is the position. Is there a recovery position for babies? Yes. Sometimes babies has vomiting, or they might have aspirated something, put something in the mouth, then they need recovery position, and this can become a medical emergency, because babies are likely to aspirate this vomiters or some foreign body very immediately. You might have seen babies swallowing or aspirating some coin or some safety pin or some small items of the hand in the house, and their version of recovery position is part of infant first aid. So, if you are learning first aid for the infant and small babies, then recovery position for them is also important, and one will be learning it. See, this is how with two hands this baby is given recovery position, slightly tilted on the left side. With one hand the chin is moved upward and baby's airway is cleared. You can perform it with one or two methods. First of all, holding the baby. Hold the baby on their side in your arm with their head slightly lower than their stomach. Keep the back of your hand under their mouth and nose to monitor breathing. First of all, like here you can, with this hand you can monitor the breathing, whether patient is baby is breathing or not. You can wet your hand to increase its sensitivity. Make sure you keep the baby warm with a coat or a blanket. So, babies are likely to become hypothermic. They reduce temperature very immediately, because their temperature centers are not well developed or not functioning properly. So, always wrap the baby in warm cloth. When you do not want to hold the baby, position the baby on their side using a blanket or another soft option to keep their head slightly lower than their stomach and monitor their breathing. Keep the baby warm again with the coat or a blanket. When you should use the recovery position? People typically use recovery position for conditions of unconsciousness and when the breathing may be weak, or when patient has vomited and become semi-conscious, or patient has something in mouth and is not able to breathe. In this situation, recovery position is important. The conditions are hypothermia, when the patient is too cold, fainting attack in the victim, diabetic coma, epilepsy and seizures. When regular patients of epilepsy, they are benefited by giving recovery position. In case of poisoning, asphyxia because of the high altitude or gas leak or something like that, or drowning, then heart attack, stroke, shock, patient is in shock. So, condition in which recovery position is required are hypothermia, when patient is too cold, patient has fainting attack, patient is in diabetic coma, regular victims of epilepsy or seizures, in case of poisoning, in case of asphyxia, that is a choking sensation, maybe because of high and because of less of air uh, available for the breathing in case of gas leakage or high altitude or drowning, heart attack, stroke, shock, and those with chronic breathing difficulties or lower back pain may find that recovery position is also helpful for sleeping comfortably. Patient with lower back pain usually they sleep on recovery position. When should you not use the recovery position? Experts do not recommend the recovery position or moving someone at all if there might be a spinal cord, head or neck injury. It is a case of accident or a injury, and if we are suspecting that patient has injured the spinal cord or head or neck, then in this case do not try to move the patient victim and do not try to give recovery position. This will enhance further damage and may worsen the case. As always, there is an exception to this rule. The Indian Red Cross Society indicates the recovery position may be necessary under these circumstances if you can't stay with the person or if their original position causes an airway blockage. But suppose in spite of the spinal cord injury, victim has choking sensation, not able to breathe properly. In this case, you have to give recovery position. And if we are going to be away and not going to be with the victim, then also recovery position helps to maintain the airway clear and victim will be able to breathe properly. If you need to move them, stabilize the neck and head and spine with when positioning them on their side. At this, when you are positioning them, you take care of their spine and head and neck. How long can someone stay in recovery position? You can keep the person in recovery position until emergency services arrives. But if the person's injury allows for it, every 30 minutes you can roll the individual to their opposite side to relieve pressure on their bottom arm. So, if you have put the victim on left side and it takes much longer time for medical help to arrive, then after 30 minutes you can turn the victim on the right side. This will decrease the pressure on the arm which is below your face of the victim and which is giving padding effect. So, to relieve this pressure you can turn again slowly on the opposite side. So, almost about 15-20 minutes, 30 minutes you can keep the patient in recovery position in one side, then turn over to the other side. Does this technique of giving recovery position helps the victim? Despite its long history of use, the verdict is still out on whether or not the recovery position is truly beneficial. Still there is a controversy. Most studies assessing it have been on healthy participants because it isn't something expert can easily study in a real world setting. Most of the time these studies are done in healthy participant and not on the real victims. That is why you cannot come to the conclusion whether recovery position is helpful, beneficial in emergency situation or not. And according to 2022 research review, insufficient evidence exists for or against the recovery position to warrant changing current first aid guidelines. So, still there is no conclusion has arrived, and this was also the opinion of the International Liaison Committee on Resuscitation in that 2020 International Concession on First Aid Science with Treatment Recommendation. In their position statement, this committee has come to the conclusion that first aid responder continue using recovery position due to insufficient evidence against this use. So, finally after all this research discussion, the concession has been arrived that one should continue using recovery position for the victim in case of emergency situation. What are the concerns about recovery position? A small 2017 study suggests the recovery position may get in the way of proper breathing assessment and delay the start of life saving CPR. So, usually CPR is given in the supine position, and if you continue giving recovery position, you cannot start CPR, it can delay the CPR. In 2022 research review, the authors agreed this was an important consideration and that it is a good idea to emphasize assessing someone's responsiveness and possible need for resuscitation before using the recovery position. So, before giving recovery position, you first assess whether patient is pulse is there, patient heart has stopped breathing, then first requirement is CPR, cardiac compression, followed by breathing. But if patient is not heart is still functioning, patient is only unconscious or semi conscious, then first you give recovery position. So, the takeaway message from this talk is the recovery position has existed for a long time and experts continue teaching it in first aid courses worldwide. Still it has been practiced. While there is uncertainty about its true benefit, it is an easy to learn tool to have on hand if you need to provide first aid to someone unconscious. So, by giving recovery position, you do not need any tools, you just need your expertise, your two hands and your knowledge. So, when someone is unconscious, not responsive, then it is a part of first aid. First is to give recovery position. This is the references taken up for preparation of this lecture, and I think learning recovery position is very basics and first requirement of any first aid training or of course, and one must learn and it will be very useful in your day to day life. Thank you very much.